New variants of COVID-19 are in Alberta, and it's raising some red flags for health officials. Good evening, I'm Tara Overholt. Well, many were hoping the daily announcement would include a relaxation of restrictions. That is not the reality, as 25 cases of the variants first found in South Africa and the UK have been detected by labs in Alberta. Officials saying all but one can be linked to travel, which means the strain is in the broader community. And the real concern over the new strains is that they are more contagious.
These variants can spread very quickly. The emerging research indicates that they have a significantly higher infection rate, estimated to be 30 to 50% higher than the strain that we've had in Alberta to date.
Health Minister Tyler Shandro provided models on what would happen if the variant started to spread through the province without measures in place, with the worst case scenario seeing 10,000 daily cases, over 3,600 hospitalizations, and 800 ICU admissions.
There's no question that this kind of exponential growth would push our healthcare system to the brink. It would significantly impact the healthcare and the services available to all Albertans.
In response, the province is increasing full genetic sequence testing to 400 positive tests per week and 300 per day for variants of concern. Shandro also announced changes to the border pilot program.
Effective immediately, participants must remain in isolation until their second negative test comes back. If either of these comes back positive, that person must isolate for the full 14 days. Now, all of the samples will be analyzed for the UK and South African variants if they test positive through the Border Pilot Project.
And due to the highly contagious variants and high hospitalization numbers, Shandro says restrictions will remain in place and any changes will be made using a risk-based assessment to activities and businesses. Today, the province reporting 362 new cases from 7,200 tests for a positivity rate of 5%. 637 people are in hospital, with 113 of those in the ICU. 25 new deaths were announced now for a total of 1,574, and 11% of schools have COVID cases.